Hey everyone, I'm here with Dr. Burdette with Precision Point Diagnostics. Did I say that correctly? Is it
You
Pre-
did.
Okay, I'll try again. Hey everyone, I'm here with Dr. Burdette with Precision Point Diagnostics, and it's a very pleasure to meet you today. Um, as you may know, food intolerances are a big problem with patients with IC and bladder pain. And I have patients who come to me who have tried all different kinds of food sensitivity tests. And some of them, they just haven't found to be very useful for them. I personally have found this particular test that we're going to talk about today to be the most useful. And I've really vetted out food sensitivity tests. I've done a handful of them myself, trying to understand the mechanism. And this one seemed to work the best for this population. So I want to go over that with you today. Personally, for me, I'm not a big fan of the IgG over-the-counter testing. I'm just going to be honest. That alone, to me, I just have not found that useful. Because what they find on paper doesn't match their symptoms. For example, they'll remove a food and they still have pain. So we're going to dive into this. We're going to kind of give you guys an overview of food reactions, how they occur, and then really how this test can really help you understand what's going on inside of your body. Hi, Cheryl. Nice to meet you today. So
Yeah, thanks for having me.
let's first talk about food reactions, because I think that's where people kind of don't really understand what's going on. One big thing I notice is people they'll eat something and then they'll flare 5 minutes later. So let's discuss, how that might not be what's really going on and what a food reaction is.
Okay, so there are two basic types of reactions to foods, and one is created by an antibody called IgE, and that is an allergy. And people are pretty familiar with an allergy, of course. You eat a strawberry and your lips swell, or you eat a particular food, as you just mentioned, and you have a burning sensation in your bladder. So that is an immediate reaction, and those get pretty easy to identify from what you're eating because you eat it and there is exactly that, an immediate reaction. Well, Journal of Immunology, and when we dig into the literature, what we know is that when people react to foods, only 50% of the time is there an allergy present, an IgE antibody. So what that means is that 50% of the time, it's something else. So the second major way that we react to foods are mediated by a different part of our immune system, something called IgG, which is a different antibody. And so those are not allergies. They're what are called food sensitivities. And these are reactions that can happen 3 to 72 hours after you ate something. You eat breakfast and you go into a flare and you're like, oh, it must be something from this morning, but really it was something from 3 days ago. So it gets very hard to tease out by a dietary history alone. The second part of that is that they can have you can have food sensitivities, some that are very minor, but some that are more moderate. And maybe you eat just the right combination of those things that kicks you up over the threshold, and you're trying to identify the one food, but really it was a combination of things that got you to that inflammatory level. So IgG is not as routinely looked at when people say, oh, yeah, but I've looked at how I react to foods. Usually, what you've looked at is allergies, IgE mediated reaction. But food sensitivities mediated by IgG can also be a culprit because, regardless of the type of antibody, the immune system gets confused. They start making these antibodies to attack food. And unfortunately, they can cross react, they can attack our own tissue. And this is that autoimmune kind of component of things where the immune system gets confused to self. And so whether or not we're talking IgE or IgG, they can cross react and attack the bladder lining, which means that you just become more irritated to more and more things as that lining becomes more worn down. So since you could have had this reaction anywhere from anything that you ate in the past 72 hours, like I said, it gets very hard to tease out from dietary history alone. So looking at those foods that you're reacting to in this manner can be really illuminating, and things that you never even realized were part of the problem when removed from the diet can be quite helpful in terms of lowering that inflammatory load.
So the IgE and the IgG, would people notice a difference in symptoms depending on which reaction they're having? As far as I know you said burning. So when it comes to IC, it's burning. When I think IgG, sorry, when I think IgE, I think a lot of people listening who go to an allergist, they're thinking anaphylaxis, they're thinking itchy hives, but are there other symptoms as well with IgE?
Yeah, absolutely. Those are symptoms. You're right. IgE are the ones that we are familiar with, like the little kid who reacts to a peanut and has to go immediately to an emergency room. So, and then the IgE reactions are the ones that you carry EpiPens for. And like you said, shortness of breath or swelling or headaches. But really, that inflammation can manifest in a number of ways. And so it's really less about the exact symptom and more about the presentation of the time. So an IgE reaction happens more immediately and creates inflammation. And the thing about inflammation is, think about it as a fire kind of smoldering in the body. And so that slow smolder, that burn, will show up in whatever your weakest organ system is. So for you, if that happens to be the bladder, then you're more likely to feel it there. But somebody else might feel immediate joint pain. Somebody else might feel an immediate headache. And so even though IgE reactions can be quite severe and even deadly, they're not always that level of severity. So it's about inflammation and the tissue that is the weakest in your system. So you could have bladder burning from both an IgE reaction as well as an IgG reaction. And this is why I think it becomes helpful to look at both of them, because unfortunately, there is not one way that the immune system reacts to foods. There are multiple ways that we react to foods. And so an analogous situation would be, for example, if I thought you were more high risk for cardiovascular disease, I could measure cholesterol, but I wouldn't want to look at that alone. I'd want to look at HDL because that's your good cholesterol, LDL because that's your bad cholesterol. And so the body makes multiple types of these lipids that tell us different things. So this is the case with the immune system as well. We can either have an immediate reaction or that IgG delayed reaction. They could both cause burning, but we would expect one to happen immediately and one to happen 3 to 72 hours later. Now, let's think about the common kind of presentation of this, which is where you might have some of both. And so now you eat something that you ate creates that immediate reaction, but something else that was on your plate creates a reaction 8 to 12 hours later, and it becomes right after now your next meal, lunch, for example. And so now it's very confusing which is what. And so being able to look at both together, I think, can be really beneficial, because both antibodies can cross-react. Both antibodies can attack the bladder and allow for more inflammation in the area that you're the most sensitive.
All right, I'm going to actually pull up a sample test here. So I think people who are visual, so they can see what we're talking about here. So here's a sample
Sure.
test. Now,
Thank you.
this will help a lot. So when she's talking IgEs on this side, this is the part with the allergy. So you mentioned some foods can have IgE, but explain that same food could also have IgG, correct? They could have both.
Absolutely. And so again, unfortunately, the immune system just isn't this simple one direction, one thing causes the other. The immune system is complex and it's evolving. And again, this is what we know. We know that 50% of times when there's a reaction to food, only 50% of the time will there be a positive IgE titer. So again, that means 50% of the time something else is happening. So like you mentioned, here is that IgE reaction, and this is what we're familiar with in terms of allergies. And so it's a great starting point to figure out what you're immediately reactive to. But again, another way the immune system can respond is an IgG antibody, and this is referred to as a sensitivity. You don't need an EpiPen. You're not going to get anaphylactic shock. It doesn't create as immediately severe symptoms. But again, it does create that ongoing smoldering fire in the body that creates that slow burn. And so if we're talking about something like the lining of the bladder, that's equally as detrimental. To say that IgG reactions are not as bad as IgE really depends on the person. For example, I had a patient, 14-year-old patient, who had IgG reactions to wheat, and it was creating such pain, costochondritis in her ribs, that she was already using a cane on many pain meds and was told that that will be the solution until the solution's no longer a cane, that it's more pain meds in a wheelchair. And so when we saw at the very high IgG reaction, we removed that from her diet, and lo and behold, what happened was, well, she walks around not with a cane, but with a phone in front of her face, texting, very normal teen behavior. And so it eliminated the need for pain meds and the cane in this patient. So it was a very severe reaction. It created a high level of pain, but it wasn't something that created anaphylaxis, shortness of breath, something that was immediately life-threatening. However, ongoing chronic inflammation is debilitating to the system and can eventually get to a place where it is extreme like that. So even though it's not immediately dangerous, it's long-term inflammation that wears down our system.
Yeah, exactly. That's exactly what I always tell people. It's inflammation. And it can happen in anybody at any age. So looking at this, you had mentioned in one of your podcasts, IgG4. And what I got from that it's beneficial. Is that correct? Can you?
Yeah, thank you for pointing that out. So the more we learn about the immune system, the more we can really drill down into what's going on. And so you mentioned that, you're not that fond of some of the over-the-counter internet IgG testing. And so what you'll notice is that, here's IgG4 and here's IgG. So what's the relationship there? So the relationship there is that we make four types of IgG: IgG1, IgG2, IgG3, and IgG4. And if you're working with something over the counter, they're probably just measuring all of these all together. And so one of the criticisms of IgG testing is, well, different antibodies act differently. And that's absolutely true. And that's why we tease this one out. This one is the anomaly of the family. This is the one that acts very differently. IgG type 1 through 3, which are measured here, this is what we make the most of, and they're very different. They create inflammation. They attract something called complement that ignites the entire immune system, really ramping up that inflammatory fire. IgG4 doesn't attract other white blood cells. It doesn't bind to that thing called complement that causes an explosion of immune reaction. In fact, it is really most of the time a good thing in our body. And why is that? Well, it's a tiny little antibody, not inflammatory. And because of its size, think of kind of like magnets. It will bind to the spot where this one, IgE, was going to bind, and it blocks it. Well, if you block IgE from binding to a cell, when IgE binds to an immune cell, that's the signal that says burst open, release histamine, create an inflammatory reaction. So now, if IgG is slotted into that spot, like a little magnet, stronger binding there than the IgE, and it blocks this, now it can't send that signal. Even if you come into contact with, for example, this person, let's even say clam is something they were highly reactive to. If they had, and they don't in this case, but if they had more of the IgG4 than the IgE, then it blocks it from binding and you don't get an anaphylactic reaction. And this could sound really surprising to a lot of you out there to think, wait, there's something that in the own immune system will block allergies from happening. But if you think through it, you probably know somebody, husband, wife, kiddo, who had a dairy allergy as a kid, but grew out of it. And so this is absolutely a real phenomenon. If we were going to die from foods that we ate, this would not make us a very successful species, right? We need food for nutrition. Our immune system shouldn't shut us down because we see a strawberry. And so our body works hard to develop tolerance. And so when you have more IgG4 than IgE, it actually makes you tolerant to that food that you were experiencing. And so when that happens, we flag that as a yes here. Yes, you have tolerance to the allergy. I know all this looks complicated, but we summarize it in a way that becomes very simple. But this IgG4 is a very well-known mechanism in allergies. So for example, if you had a clinician that recommended desensitization, like through injections, where you go get injections to not be allergic to something, or you can also deliver it under the tongue in some circumstances. So either injection therapy or sublingual immunotherapy, the whole point of that therapy is not to decrease IgE, but to increase IgG4, which blocks IgE. So we know we can become tolerant. We know we have ways to push the immune system in that direction. And in fact, not just desensitization does that. When you look through the literature, things like probiotics will increase IgG4. Things like omega-3s will increase IgG4. And so the idea that you're stuck in place with an allergy is not accurate. You do see antibodies go down over time. Historically speaking, docs would say if you have an IgE reaction, you never reintroduce it. That has changed in the practice of allergy and immunology. They will reintroduce foods now. If it was a very severe reaction, it's often done at the clinic with the presence of an EpiPen, et cetera. But we really realize that this is not something we're stuck in place with. The body wants to become tolerant to foods. We don't want to die or react to foods. And so we're wise. And so once we start to have a reaction, hopefully you begin to make more IgG4 than IgE. So IgG4, like you said, is generally a good thing, but the immune system doesn't like to be black or white. Nothing in medicine likes to be exactly black or white. It's usually good. However, there are a handful of what are called IgG4 reactive disease. And so there's a few times where you will take out IgG4 as well. An example of that is something like eosinophilic esophagitis, long name. But again, that is one has more IgG4 immune confusion. And autoimmune thyroid conditions are probably a more common one where that is the case.
Oh, really?
So
Okay. So
yeah, so I used to run around saying, oh, IgG4 is always good all the time.
yeah.
But then as we learn more about the immune system, well, most of the time, but there's some times when even that, but still it's a different mechanism than the total IgG.
Yeah.
It's not that it's creating inflammation. It's not that it's attracting other white blood cells. It's just kind of like grit on your brand new hardwood floor. It just is, eventually there can be so much that it just precipitates out and it will lodge in the esophagus and create just irritation just from its actual presence of a lodge in the thyroid and create more irritation there. In general, it's good. We don't have to worry about it unless there's a handful of times you have a condition that's driven by that. And that's why it's important to work with your clinician when going through these things, because they're going to know, okay, keep these foods in or take these foods out. You're probably going to have a more robust diet when you're working with the clinician to decide what's most important for you.
Yeah. Okay. And it sounds a lot like IgG4. It reminds me a lot of interleukin 10. in a lot of ways.
Exactly. And it's a really good point that you make because interleukin 10 increases IgG4. And so interleukin 10 is this interleukin in the immune system. It's an immune signal. And it's the one that says, calm down, don't be reactive to things. And in fact, the first time that you're presented with a lot of interleukin 10 is through breast milk. And so breast milk sends this signal to baby's gut to say, hey, these foods that are coming in, they're normal, calm down, don't react to these things. And so when there's more of this calm down signal, we produce more IgG4, and probiotics and omega-3s increase that calm the immune system down signal, that IL-10, which helps to produce more IgG4. So you're spot on.
Yeah, and those of you who've actually worked with me know why I love doing the omega testing, because we like to see what's going on with that as well, because of the inflammatory pathways that they influence. So let's just roll over here to the C3D, which is the complement, and how it affects the IgG.
Yeah. So again, a lot of things going on in the immune system. IgE, allergies. IgG4 blocks your allergies. Then we tease out IgG subtypes 1 through 3, the true inflammatory ones. And see, that's why we separate these, because some people say, no, IgG is not good because different ones do different things. And so that's more the over-the-counter. They group all these together. But we tease out the one that's different, look at the sensitivities, and then we add one more thing to that because it's one more way the immune system reacts. So if you have IgG and you have this thing, complement, C3D, they bind together. And when they bind together, they amplify that reaction 1,000 to 10,000 fold. So I always say it's like, boom, Wonder Twins activate, form up a very explosive reaction. And so the two together are what really cause this more explosive reaction to occur in the body. We're not as much worried as with complement all by itself. It doesn't have enough power to do anything alone. But again, it's that activation when it binds to IgG that it becomes the biggest deal. So this is another criticism of IgG testing. It's just not the whole story. If having complement there amplifies your IgG reaction 1,000 to 10,000 fold, then, for example, this almond on the top that's just moderate, but with a high complement, is likely to create even more of a reaction than, for example, brewer's yeast here, which is high, but with no complement. So if you were only measuring IgG, you're leaving out that thing that amplifies 1,000 to 10,000 fold. And so you might have done testing like this and gone, I don't know, these things that are high, I don't really have a reaction to. It's the ones that are moderate that I see more of an issue with. And so it's because you're missing a piece. If it was moderate with complement, that can be a much bigger deal. Complement is like your igniter fluid on your charcoal. When you have the two together, that's when the fire is going to really take off. One by itself, that's not the explosive reaction. But when we put those two together, that's when we can really amplify that burn.
Great. And as you can see on this test, there's about 88 foods. And now I know we're talking about a lot of the mechanisms, but you don't really need to worry too much about that. It's just for your own. I'm really doing this for people to have confidence in this test, honestly, because I think they get really confused. But the good news is, as you go down to the third page, they're going to give you some suggestions based off of the algorithms, I guess, that were calculated above, because all those numbers, they all kind of mean something. But you can always go back and look to see when you see something here, you can go verify up here what that reaction looks like. But they have a less restrictive and a more restrictive diet. Can you just explain to them why there's two different lists, less and more?
Yes, because we are human beings. And so we have different levels of ability to change our diet. If you have not done a lot around dietary change, then it takes a minute. Patients will go, oh my gosh, this is going to take so much more time. And you're right about that initially. The first few times you go to the grocery store, the first few times you're reading those labels differently, but it's a learning curve. And once you go through that learning curve, it doesn't actually take more time than what you had already learned to eat. It's just you're learning a new way to eat. But that can be overwhelming. And so sometimes, when you're really just getting your feet wet in terms of making some of these dietary change, maybe you struggle with kind of different flavors and textures out there, then we might say, okay, for you, we're just going to start with the less restrictive diet because I want you to really be able to get focused here. Or a second time we might do a less restrictive diet is, let's say you're there more for some general prevention or wellness, you have a little bit of fatigue, you haven't been sleeping quite as well at night, then we might say, okay, the less restrictive is enough to calm down your level of inflammation. But if you're an IC patient, then I would probably, and this test is more extreme than most, but I would probably suggest starting with the more restrictive diet. And the reason for that is because that's going to more quickly calm down the inflammation and you're going to more quickly feel better. That's your strongest move in an anti-inflammatory, let's not burn, let's not hurt direction. And so when you do that, you create an opportunity for that bladder lining to build. And so why is that important? Well, these antibodies, IgE or IgG, again, like I said, they cross-react and attack your own tissue. And so they can attack the gut lining, and then everything floods in. It's like a fortress, and the wall around the fortress is your gut lining. Well, it's all broken down. So now everything you eat floods in and can create this inflammation. The battle on the inside is much more easily won when the gut becomes leaky. In addition to that, now once all that stuff floods in, it's much easier to irritate the bladder lining. So you're going to take these foods out and you're going to work with someone like Dr. Mandy, and they're going to also suggest to you things that build the gut lining, nutrients, things that build the bladder lining. And so you're removing that irritant. So it's not as hard to push the boulder uphill. But ultimately, the goal is not to restrict these things from the diet for forever, to take them down, calm down the inflammation, build that gut lining and build that bladder lining. And it's interesting, some of the things that do one do the other. So some of our glutamine therapies and our glutathione therapies work in both areas. Dr. Mandy can talk to you more about that. But then when those linings, when your border is back in place, when your fortress wall has been fortified, now you begin to reintroduce the foods. And typically the way that's done is with your clinician. So they'll direct that. But an example of how that can be done is you'll start with the ones that you had the least reaction to. And then you wait 72 hours to make sure that you're not having any kind of flare from that. And then you'll add the next one, so on and so forth. So the idea is really not to create the most restrictive diet. The idea is to do that for a period of time, lower the inflammatory load, build you back up, and ultimately to be able to eat more foods than you were able to even originally, because you've calmed down inflammation. Speaking to Dr. Mandy, I think that I heard from you that is what you experienced, that some foods that you couldn't tolerate initially, after you did some of this, now you've brought back into your diet and you're fine with?
Yeah. And there is a bit of PTSD that's around this. I'm going to be honest with you. For me, I'll just say it was chicken was one of them, which was surprised me because I thought it was so benign. Like we associate like inflammation with like, wheat and dairy, and yeah, those are problems too. No, there's no question about that. And I did not reintroduce those two. But I did reintroduce the chicken, but the PTSD it took me a little longer than most people should. Like, I think it took me a year before I was like, I'm ready to have chicken again because of the PTSD. I do believe that that's another thing that's going on with this, which is why I want you guys listening to understand, because a lot of people who come to me already have a lot of PTSD and food fear, and even some distorted eating mentality. And so that's why she's saying that purpose isn't here is to eliminate and to ruin your life forever. The purpose here is to actually open you up to more foods you couldn't eat before. But with that, initially there may be like, in this, okay, this test is extreme. I'm going to be honest with you, but it's not that I've never seen something this extreme before. I have,
Yeah,
but maybe about 5% of the time. This is
exactly,
the
exactly.
worst of the worst. So if you guys are looking at
Yeah,
this, it's probably not you. You know
yeah,
what I mean? You may
yeah.
be more here for the more restrictive, more likely. But let's just say this is you and you're on this side and you're like, oh my God, this is all I can eat. Well, first of all, no, it depends on how aggressive you want to go with reducing your inflammation. But if this is too restrictive, they do have the immune index, right? So should we just scroll
Mhm.
into that and explain how
Yeah.
that works?
Yeah, so right, it's confusing. We're looking at 4 different ways the immune system reacts, and sometimes you react in one area and not the other, and sometimes you react in all the areas. So this is a patent pending proprietary formula where we do a calculation of those reactions, of those 4 reactions that we looked at on the first page. And so the reason for doing that is exactly as Dr. Mandy said. It's because sometimes you can just come back reactive to so many things. So in a case like that, of course, you can't limit your diet to 8 foods or 6 foods. And so she'd probably work with you and say, okay, let's just focus on the ones you have the most reaction to. And the good news is the ones you have the most reaction to are the ones that are causing the most symptoms in general. And so getting rid of those, you'll begin to feel better. And then you might come back on follow up and you're 80% there. And you might say, yeah, but I really notice when I throw that banana in my smoothie, that I have problems. And when I had that omelet, that was a bad day too. And so then from there, you might say, okay, so those were on your moderate list. Let's add those for a minute. And to Dr. Mandy's point about she took a year before she reintroduced things, that's not entirely unheard of. I know it's not the first thing you want to hear. What we all want to hear is, oh, do it for a week and then it will be better. And you do start to feel symptomatic improvement, often even within a couple weeks. But ultimately, especially in IC, we know that immune system has just been really ratcheted up. And so if we're really trying to train the immune system to behave more normally, then we think about, okay, what else does that? Well, back to those injection therapies. When people do injection therapies, they're often on them for 1 to 3 years. So to really change the immune system, you're thinking about that length of time. Now, in terms of food removal, it's not quite as long as injections, but 9 months to a year is really that point where the immune system starts to shift how it's looking at things. And so you'll feel better much more quickly than that. But if the goal is really to bring more foods back in, I suggest, at least a good 6 to 9 months, especially when you are more severe, because that is what allows the immune system to regroup and retrain so it knows what it's attacking and knows what not to attack, which is you. The second part of that is you have to build linings back. And so it's like me saying, I want nice biceps. I'm going to go to the gym one time. Well, I'm not going to build a bicep with one trip to the gym. That's tissue. I got to work at that. I got to keep doing that. And if I were 18-year-old male, I maybe could do that in a week or two, but I'm not. I'm a year old female. And so that's going to take consistent work and activity. So also you're faced with the issue in terms of you need to rebuild that lining as well. And so that's more like a 3 to 6 month window. But again, to really retrain the immune system, probably 6 to 9 months so that you're adding things back in and not relapsing.
Yeah, and there are other things that we've done. I've had, a couple patients who've had a severe reaction like this. And for one of them, we actually ended up doing a 5-day gut reset, which I think Dr. Ruscio has a formula that you just do 5 days of this protein powder that kind of, because the gut does turn over every 72 hours. Is that how long it takes for the cells of the gut lining to turn over?
Yeah.
Really severe.
Yeah.
There are things we can do like that. If you really wanted to accelerate this, some people don't want to do that. So in that case, you're going to looking at a longer window. And then there's peptides. I mean, there's things you can do. So please don't think
Yeah.
this is a forever thing because it's not.
And I should amend my statement and say, some of the lower level reactivity of foods, the lows and the moderates, you can bring some of those back in a little sooner. It's the ones that are higher level reaction that you're keeping out. So all along the way, you're working with your clinician, you're opening your diet back up. And I should also confess that there will be, a couple of foods often for people that they just don't tolerate ever. Gluten is a good example of one that is just, it has so many ways that it bombards the immune system beyond just allergies and sensitivities. It's one that many people just do better with long-term taking out. Dairy's the other big one. Good news is those things have gotten a lot easier to deal with than it was 15, 20 years ago.
Yeah, so the wheat is for sure. I avoid that like it's poison. But I was also reading a journal the other day about how different components of wheat can actually also provoke histamine. So it's not just, I think everyone assumes that wheat is really is more like that leaky gut, intestinal barrier thing, but there's many ways wheat can provoke histamine. So I just blanket statement here is if you have bladder pain syndrome, IC, more than likely wheat and dairy are going to be your top problems. And then looking here at the immune index, again, I keep emphasizing this because I think people, when you look at this list, it's a little daunting. But if you come down here, you can actually start from the bottom here and work your way up, obviously carefully, because another area where IC patients have a problem with is oxalates. Okay. Now, we know that oxalates are variable in foods, right? Some foods have high oxalates like the spinach, and some foods have less oxalates. It's dose dependent. And I also even believe it's individual dependent. I think that a person's ability to break down oxalates appropriately, it is individual based on genetics, based on their microbiome, based on digestion, based on, fat digestion, all that other stuff. But it's nice because they do actually list it here too. And what we would do is like, okay, let's say this person, well, okay, let's just explain this. This is new. So explain this first.
Yeah. Yeah. So exactly what you were saying about gluten. Sometimes there are reactions that are not allergies or sensitivities. There's still a reason that in the case of gluten, it provokes histamine. And so what we wanted to do is say, what are the foods that you are reacting to? Now let's see if there are any other patterns with those foods. And so we took some common reasons that people react to things. And kind of and cross-referenced, like on the food test, these foods are high histamine. So if you have a reaction to them, they show up, for example, here in the histamine column, or like you pointed out, oxalates, and they have an intimate relationship with the kidney and the bladder. And, oxalates can be one of the major reasons people form stones, for example, and so kidney stones. And so again, that tie-in to that area of the body. And so then let's just see if the foods that you're reacting to, if there's a lot of them that are also high oxalates. To me, this is a secondary tool. So I would always just start with removing the things that your body reacts to. But then again, let's say you get 50% improvement, 60% improvement, and you're like, then that's the time Dr. Manny's going to turn to this and she's going to say, you know what, you had a large grouping in the FODMAP category. And so this is a category of foods that are high in disaccharides, and some people, which is a type of sugar, and some people just don't break that down very easily, and so they bloat more from it. And so she might say, I'm going to put you on a low FODMAP diet. But to her point, much more common might be to say, you know what, you do react to a lot of oxalates, so let's put you on a low oxalate diet as well. And so it's a secondary lens to say, in the foods that you're reacting to, could there be other mechanisms that are perpetuating that? Let's just see how they all kind of cluster to give us more information.
Yeah. And, for example, in this case of blueberry, so you have a high reaction, and that's based off of the calculations above, and this high oxalate. So you can get also a reaction because of the oxalates, and the oxalate itself can promote inflammation too. So you could be getting inflammation from those other mechanisms, and then on top of it, the oxalates could also be amplifying that. So that's why for this person, if you had IC, I say, blueberry is probably a good idea to remove out of your diet. And when you do reintroduce it, we're going to watch the quantities of it because of the oxalate content in it. So that was really a nice addition to this test. I like that. So it goes through both pages.
Okay.
Now, this is another one that I thought was good too. Well, there's food family, so explain that, and then there's the fungal markers. Those are the two here that are interesting.
Yeah. So obviously, we test 88 foods, and obviously that is not every food that's on the planet. So sometimes you're saying, yeah, but well, we had somebody ask once if we could do camel milk. How do I react to camel milk? And so we don't test that. But that would be in the dairy family, obviously. And so this allows you to say, okay, what food families was I most reactive to? And so this person, in terms of IgE food families, their worst ones were only moderates, but shellfish, grains, nuts, and seeds. And so in a case like this, as I would still, again, it's a secondary lens. First, remove the things you're most reactive to. But then upon evaluation, let's say you're doing better, but you're not perfect yet. And let's say maybe you were high in the grains and grasses, then Dr. Mandy might say, okay, let's try a grain-free diet for a couple weeks, see if that calms things down even more, because some of the grains are not tested here. So, I don't think you're ever going to get off so easy as having a high reaction in the vegetable category, and she's going to take you off all vegetables. This is not one that I tend to kind of use that way. But to me, the two biggest ones of importance are, if someone's high in the grain and grass family, you can see good outcomes then removing all grains for a period of time. And the other one, to me, this is not the case here, they're only low, but if they're high in the fungus family. And so then we might adopt a low mold diet. And so it does require taking out some other things like apple cider vinegar and cantaloupe. It tends to be a moldier food, and peanut butter, a moldier food. And so you take out some of those high fungus foods, and oftentimes you can see improvement with that. So again, it's just a secondary lens to say, what's the cluster of an area that you're most reactive to, but this time asking, what food family was it in? Interesting overlaps with food families. For example, you might be familiar with the fact that bananas in the latex family. So if you have a latex allergy, you could be more reactive to banana. The one I find most fascinating is, let's say that you had a reaction, an IgE reaction to beef, and you are a long-term vegetarian, maybe even vegan. Well, there's a cross-reactivity there with tick bites. And so that's published in Journal of Allergy and Immunology. I mean, that's a very well-established cross-reactivity. And so again, looking at some of these food families and cross-reactivities within the food family, and even cross-reactivity between things in the environment and foods, can give us another picture. And so there are physician guides that come with this test that kind of go over some of those cross reactivities. Another interesting one to me is clam. A lot of people will come back reactive to that and they go, I don't eat clams, I don't like clams. Well, the environmental cross reactivity is with cockroach, and that's a very common environmental sensitivity. Not that anyone's eating a cockroach, but the little bits of it, just like their skin and dust, or little bits of cockroach that get in dust and whatnot, people can react to that, and that can cause a cross reactivity in terms of clam reactions.
I never heard that before. Wow. I never even heard of the cockroach, actually. That's the first one for me. Interesting.
Yeah, it pretty commonly shows up on those like skin prick tests and in those environmental allergy tests. That's a
Oh my gosh, just to think that they're crawling around and spreading out there. Oh my goodness. So let's see. So fungal markers, could that also be, if somebody has a fungal marker that's elevated, in this case it's not, but if it was, could that indicate there may be some overgrowth in the gut as well as another clue?
Absolutely. Good point. So we measure your reaction to yeast that can be in the gut. And then the major one that shows up there is something called Candida. It's a type of yeast. And you think, well, why would a food test measure reaction to yeast? Nobody's sitting down to a plate of yeast and eating, this one Candida. And so the reason that we do that is because if you have more yeast in your gut, one of the things it does is it breaks down that first line defense, that barrier. It's part of that leaky gut story. In this case, there's an immune lining on our barrier that makes up 85% of our immune system. And that immune lining is called IgA, or secretory IgA. The yeast will chew up your first line defense, that IgA that lines the gut. When that IgA gets eroded, the next thing that happens is the rest of your immune system says, oh my gosh, I better be on hyper alert. I better really ramp myself up. So think of it like, again, an army, your front line is down, they're drunk, they're out, they're not doing their job. So everybody on the back line has to say, oh my gosh, high alert, get my swords out, my shield out, be more reactive. And so yeast will cause your first line in the immune system to go down, the one that's in that barrier. And so now your IgE reactions will go up. Your IgG reactions will go up. And this is important because one of the major ways we make those things go down is you remove the food so the immune system calms down. Well, this is that case where you remove the food and you are really good about it, but yet the reactions, the IgE and the IgG titers, they're called, they are still staying elevated, and you're like, what's going on? That's a great time to think about, okay, how did that yeast reaction look? Because it can perpetuate our allergies and sensitivities. And now instead of or alongside the food removal, doing some things that are natural antifungals, like coconut oil is a good example of one, but there are many out there. Doing some natural antifungals knocks down the yeast, helps your normal microbiome, and that will bring down food reactions.
Yeah, I see this a lot with people with really bad histamine problems, and the yeast overgrowth. So I'm glad you brought the IgE tie that into that, because I see that a lot. Well, that takes me into the last piece here that I do with so I bundle this test, and it's bundled with this one because I feel like we are dealing with a histamine issue. We're dealing with diamine oxidase deficiency. I mean, I see this time and time again. And then on top of it, then we're wondering why we have these food intolerances that are a lot of them histamine-driven symptoms. So this test is great. It pairs really well with the food sensitivity test. I'll just quickly walk through these different markers that they have here.
Yeah. So as Dr. Mandy has talked about, one of the major reasons that we react to foods is because that barrier breaks down and now you have a leaky gut, everything floods through and the immune system makes these antibodies that react to it, that can cross-react and attack our own tissue and cause symptoms. So are there markers of leaky gut? Can we measure this? And it turns out the answer to that is yes. So one of the first things that will make the gut more leaky is this guy, zonulin. And zonulin so the way that the gut gets held together is by something called tight junctions. Think about like Lincoln logs and where they lock together. And so zonulin tells those tight junctions to open up. So I visualize this as like hitting the button on the garage door opener. It tells those tight junctions to open. And so now things can flood through. So if zonulin is high, that tells us that the gut is leaky and you are more under attack. However, that's not the only way the gut becomes leaky. Another way that gut lining can become leaky is just wear it down, wear it down, wear it down. And so NSAIDs, non-steroidal anti-inflammatories, are an example of that. We know that you can take those so much so that your gut lining ulcerates. That's a pretty leaky gut, but it's not zonulin mediated. So to me, this is like, now I'm at the garage door with a sledgehammer, just beat it down, beat it down, beat it down. And eventually, I'll get in. It's not tight junctions opening. It's just atrophy. And so diamine oxidase is a measurement of atrophy of the gut lining. It's an enzyme and we make it right here in the gut lining. So as you wear this down and wear it down, you make less and less and less. So it's a marker of how strong is your barrier. But interestingly, that enzyme is the one that degrades histamine. So when you're low in diamine oxidase, now you've got a double whammy. Your gut is leaky, and anytime you're presented with histamine, you can't break it down. So that histamine is going to be even more agitating to the gut than it would have been otherwise. And it can become a reason that the gut stays more leaky. So not all foods, most foods have some level of histamine, like a strawberry has histamine, tomatoes have histamine. Let's say I eat something on Monday and then I have my leftovers 3 days later. That exact same food now has more histamine because as things ripen or degrade, histamine is produced. And so it can get confusing. Again, you go, I know it can't be this food. I ate the exact same thing on Monday. Well, it could be because it begins to form more histamine. And if you don't have the enzyme that breaks that down, which is this diamine oxidase, you're just stuck in this reactive area. And I've seen great outcomes with IC, making sure that that diamine oxidase is being produced like it should, because of course you want a huge amount of the enzyme that breaks down histamine. That's going to decrease inflammation in general. And the way we do that, well, you can give it, it exists as a supplement, but the way you do it long term and not have to take a supplement is you build up that gut lining. And the stronger the gut lining, the more diamine oxidase we produce, the better you're going to deal with histamine.
Yeah,
So
and
we measure.
yeah,
Oh,
well,
go ahead, sorry.
they mentioned Diagnostics also has its own cofactors as well for production or optimal function of the enzyme as well. And copper, vitamin C, I don't remember first offhand what those vitamins were. So if you're low in those, which we also do hair tissue analysis testing as well, if you're low in minerals or some of the vitamins, that can also impair its ability to function properly.
Yeah, excellent point. Fish oil is another one that helps diamine oxidase work better. Saccharomyces, actually a favorable yeast for the gut, what helps it work better. But you're 100% right with the B6, B5, copper, vitamin C. Those two will, so it helps, it gives you a lot of indication of things that might be going on. And then we look at that histamine because just what's your level. But what the research really talks about is, do you have enough diamine oxidase for your level of histamine? So that's why we do this ratio. You could have a fairly decent amount of diamine oxidase, but if your histamine was off the chart, you would still be inflamed from it because you don't have enough to keep up with the other. So that's why we include the ratio. Do you have enough diamine oxidase to deal with your histamine? And then finally, we look at lipopolysaccharides, and these are things that are shed from bacteria. Their other name is bacterial endotoxin. And so what they do is they're kind of like, now we're in there with the crowbar in terms of trying to get in. And so they go into those tight junctions and wedge them open. It's not an elegant signal like zonulin, but they're still getting in there, wedging open the gut. Also, in fairness, they can go in through some gut cells as well, but lipopolysaccharides really trigger the immune system too. So they damage the lining, they make you leaky, but then one of the major things they do is they bind to a type of white blood cell that is the one that calms the immune system down. So we know that there's an overreactivity, more inflammation, parts of the immune system are confused and doing the wrong thing. Well, there's something called a Treg cell, and that's short for T regulator. And so it's the one that says, hey, immune system, we don't want to be too high, we don't want to be too low, we want to be in balance. So it's that pivot point. Those Treg cells it's a hallmark of autoimmunity. When we look through things like lupus and rheumatoid arthritis and even IC, a hallmark of that is those Treg cells aren't functioning like they should. Well, lipopolysaccharides bind to those Treg cells and make them dysfunctional. So that key part of your immune system that's trying to keep everything in balance the right level to still fight pathogens when we see them, but not so high that we're overreactive and creating too much inflammation. These lipopolysaccharides, they really interfere with that cell's ability to do its job. So when we see these reactions to the extreme sides, high initially, but after a while, then the immune system bottoms out and they can be low. That's why you see a little bit of red on each side, but mainly high is the big deal. They damage tight junctions, which makes the gut lining leaky, and they also decrease a type of white blood cell that keeps the immune system nice and balanced and prevents inflammation.
This particular person may have had long-standing endotoxemia, and maybe, like you said, the immune system kind of bottomed out, it looks like.
Yeah, exactly. Yeah.
Yep. So we bundle these tests together. And the main purpose is just to give you a little bit more insight, especially since that histamine diamine oxidase piece is so key. I mean, I start people on the, you can get it from kidney extract, by the way, supplementally, or from food. I personally, I do eat kidney. It has helped a lot. So, well, thank you so much, Dr. Burdette. This was great. And hopefully people shed some light as to why I use this test. Like I said, I've vetted out a lot of other tests and we try them. And I really do think that this one is the best for people who have interstitial cystitis and bladder pain syndrome.
Well, thank you so much for having me. I really appreciate being able to explain it, and always know you can reach out to us if you have any clinical questions. So we provide resources to Dr. Mandy. So if there's something unusual, we're here to back that and really help you get the most out of your test result.
Thank you so much for being here today.
Take care.
Yeah.